Amidst rising cases of COVID-19 and seasonal influenza, the government is planning a nationwide mock drill on the 10th of April and the 11th of April to take stock of hospital preparedness. According to a joint advisory issued by the Union Health Ministry and the Indian Council of Medical Research, both public and private health facilities in all districts are expected to participate in the exercise aimed at taking stock of the availability of medicines, hospital beds, medical equipment and medical oxygen. The exact details of the mock drill shall be communicated to the states in the virtual meeting scheduled for the 27th of March. Naveen Nishant is joining us live from Delhi on this story. We also have Sujata Dwivedi joining us live from Mumbai. Naveen, coming to you first, amidst the rise in COVID cases across India and also in Delhi, what is the Union Health Ministry planning for the 10th and 11th of April?
बिल्कुल देखिए बता दें कि पिछले 4 दिनों से देश में कोरोना के मामलों में लगातार वृद्धि हो रही है और जो कोविड के मामले हैं वो लगातार 1000 के पार जाते जा रहे हैं। तो ऐसे में केंद्र सरकार ने 10 और 11 अप्रैल को देश भर के सभी बड़े अस्पतालों में मॉक ड्रिल करने का प्रस्ताव दिया है, जिसके अंतर्गत रिस्पॉन्स टाइम, सबसे बड़ी बात, जब भी कोई मरीज हॉस्पिटल आता है तो कितना समय लगता है डॉक्टर को उसे अटेंड करने में, तो इसकी मेजरमेंट की जाएगी। इसके साथ साथ हॉस्पिटल में इक्विपमेंट्स और इंफ्रास्ट्रक्चर क्या कुछ है, ऑक्सीजन प्लांट की क्या स्थिति है, इन तमाम चीजों का जायजा लेने के लिए मॉक ड्रिल किया जाएगा। और सबसे बड़ी बात यह है कि दिल्ली में भी पिछले 4 दिनों से बात करें तो कोविड के मामलों में लगातार बढ़ोतरी आ रही है। कल भी 100 से ज्यादा मामले दिल्ली में सामने आए थे, तो इसे लेकर दिल्ली के जो तमाम सभी बड़े सरकारी अस्पताल हैं वहां पर आज मॉक ड्रिल होना है। दिल्ली सरकार के जितने कोविड अस्पताल है, चाहे वो लोकनायक हॉस्पिटल हो या जीटीबी हॉस्पिटल हो या फिर जो राजीव गांधी हॉस्पिटल हो, इन तमाम हॉस्पिटल में आज मॉक ड्रिल होना है। लेकिन सेंटर द्वारा 10 और 11 अप्रैल को मॉक ड्रिल होना है और इस मॉक ड्रिल का जो मुख्य मकसद है वो कहीं ना कहीं हॉस्पिटल की तैयारियों का जायजा लेना है, क्योंकि बीते दिन भी जो चीफ सेक्रेटरी हेल्थ हैं उन्होंने 6 राज्यों को पत्र लिखा था और कोविड के जो प्रिकॉशंस होते हैं उन्हें लेने की भी अपील की थी, जिसमें केरल, कर्नाटक के तमाम राज्य शामिल है, क्योंकि कई राज्यों में जो कोविड के मामले हैं वो लगातार बढ़ते जा रहे हैं। दिल्ली की बात करें, दिल्ली में मामले लगातार बढ़ रहे हैं, गुजरात है वहां पर मामले बढ़ रहे हैं। तो ऐसे में केंद्र सरकार लगातार राज्य सरकार के संपर्क में है और उनसे लगातार जो कोविड एप्रोप्रिएट बिहेवियर होते हैं वो फॉलो करने की अपील कर रहे हैं। और उसी कड़ी में 10 और 11 अप्रैल को पूरे देश में जो है मॉक ड्रिल होना है हॉस्पिटल्स के अंदर, और इसके लिए 27 तारीख को जो तमाम हेल्थ सेक्रेटरीज हैं राज्य की, उनकी एक वर्चुअल मीटिंग भी बुलाई गई है, जिसमें आगे की जो गाइडलाइंस हैं वो तय किए जाएंगे।
जी नवीन, बन रही आप हमारे संग। सुजाता द्विवेदी भी इस वक्त हमारे संग है। सुजाता, महाराष्ट्र की इस वक्त स्थिति क्या है? व्हाट इज द सिचुएशन इन महाराष्ट्र एज फार एज कोविड इज कंसर्न?
Well, Uday, if we talk about the country's COVID cases at present, Maharashtra accounts up to 21% of the daily COVID cases. And to set up, to reduce the graph, we see that the Maharashtra government has instructed the hospitals to set up daily testing. Now, other states are reporting a spurt in cases, including, several other states. And the central note, which was, of course, signed by the Union Health Minister Rajesh Bhushan, said that the COVID testing in some states is insufficient as per the World Health Organization, which is why daily tests has to be increased, especially in Mumbai, because if we talk about the yesterday, daily COVID cases were somewhat around more than 105 in Mumbai and more than 500, around 534 in Maharashtra. So this has been alarming for the BMC, and the BMC executives are said that they will be testing in Mumbai is close to the WHO requirement, which is why on an average 1500 plus people are being tested each day, and they will be increasing that with time. Now, talking about the mock drill which will be conducted on the 10th and 11th of April, as my colleague Nishant too mentioned, that this is going to be to check about the sufficient amount of medicine and beds and the wards to be kept ready for the COVID. Now, if you remember in the recent light, again, when the COVID cases were on a rise, there was a mock drill conducted nationwide to check about the availability of medicines and all the other requirements of a patient in the hospital. And in Mumbai too, we see that it has been one of the major places where COVID was seen on a rise, which is why the Maharashtra government is holding meetings each day with the state health department as well as the government hospitals to find out, their condition at present, and also people have been suggested to wear masks at, the places which are of high level COVID spread. Now, talking about those in Mumbai, if we see in the western line, Dadar and
Yes.
ahead of that Lower Parel, Prabha Devi, all have been, declared as a COVID prone zone, which is why people there have been advised to start working with masks.
But it is
and
a double whammy as far as health posts go, isn't it, Sujata? Because, influenza cases have also been on the rise recently.
Yes, definitely, Uday. We see that the cases have been on a rise on the recent scale, and also the government. This is what is concerning the government, because not only COVID but also the H3N2 viruses, which is why in specialized hospitals, in JJ Hospital or be it any other hospital in Mumbai, there were specialized COVID wards that had been made during the COVID period. However, they were locked after the COVID lockdown was lifted up. Now again, the government has been advising the hospitals to reopen those wards and dedicate them to the COVID patients who would come and, they show symptoms of COVID and dedicate it for their treatment. So as of now, the government is in full swing to guide the hospitals to keep their wards ready, and also guidelines soon will be released for the private hospitals as well about their functioning in regards to COVID, because we see that the government hospitals have already been filled up with patients. Well, patients, they prefer getting admitted in the hospitals and getting themselves treated rather than being at home and recovering from quarantine, which is why the government is planning to increase the number of beds in hospitals, and also first measures are being taken to curb the spread of COVID, and if it keeps on increasing, masks will be made mandatory, and also the beds in hospitals will be increased, and to check about the availability of staff, the medicines, the vaccines, everything is what the government is again setting up a committee to follow on.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.